Okay, so we are going to start the flag ceremony. So we shall be calling countries by countries, and the countries will be called according to the alphabetical order to make sure I'm not biased at all. So I would call a certain country first, and you think that's my favorite. All the countries are my favorite. Please, if you have been planning to give me an invitation, don't hesitate to. So for this official moment that we're going into, I'm going to call upon the Ipsf President and Secretary General to come forward. These are very important people, but I wanted to make a comment. Does the August House allow me to make the comment? They are gorgeous, don't they? Yeah. So that's the comment I wanted to make. Anyway, Ipsf is all gifted. So I'm starting. So when we call you, I don't care whether you are 100 or you're 1,000 from that country. Guys, come forward. This is a historic moment. Have this picture. So make sure you have this photo taken in Kigali Convention Center, the iconic dome, the best building in Africa. It's the best. The architecture design is awesome. So most of you have been seeing it at night passing by, and you thought even inside it is circular, but it's rectangular. So I'm starting by Algeria. Algeria. Another big round of applause for Algeria. Wow. I'm appealing to the people in charge of taking photos. Please, this is a very important moment. Take the best photos ever. Take the best. So as Algeria is taking their photo, Australia should be warming up. Australia should be warming up. Yes. Yes. Austria. Oh, sorry. Australia. Australia. Big round of applause to Australia as they come forward. Australia.
Yes,
wow.
They came prepared with the flag.
Very creative indeed.
As Australia are taking a picture, let's Austria people, please warm up. You're up next.
Next is Austria.
Let's welcome Austria, please. Accueillons les gens du Burkina Faso. Burkina Faso. Yes.
Round of applause to Burkina Faso.
As they're taking their picture, please, Canada, warm up. You're up next. Où sont les gens du Canada? Where are my Canadian people?
The Canadians. A big round of applause. She's won. She's a hero. As the next is the country that hosts the president of Ipsf, Croatia. Croatia. Another round of applause. This is a huge delegation. This is a big delegation. They deserve more than that. Thank you. Thank you for being part of the 65th World Congress. As they're taking their photo, Cyprus should be warming up. Cyprus. Next is Cyprus. Yo, another hero. Another hero from Cyprus. Round of applause to one-man Cyprus hero. So as Cyprus is taking their picture, Czech Republic, another hero from Czech Republic. And the Secretary General is also from Czech Republic. Wonderful. Wonderful. Then Denmark should be warming up. A big round of applause to Denmark. Is another hero from Denmark. Two. Wonderful. Three. Wonderful. I'm just hoping you can go on and on until they become like 50. As they are taking their picture, DRC should be warming up.
La République démocratique du Congo. Où sont mes gens du Congo?
Is another hero from DRC. DRC is our immediate neighbor in the west.
Yes. Up next we have Egypt. Let's.
Egypt. Round of applause for Egypt. Very creative. As Egypt is taking their photo, Finland should be warming up. A big round of applause to Finland. Finland. And as Finland is taking their photo, France should be warming up as well.
Accueillons la délégation française. Où se trouvent les Français? A very big round of applause for them, please. Yes. A very creative flag, I should add.
France will be recognized for having come with the biggest flag in this event, at least so far. We don't know what comes next. After France, we are calling Germany. A big round of applause to Germany. A big round of applause to Germany. That's a big delegation, aren't they? So as Germany is taking their picture, we're calling Ghana to be warming up. A big round of applause to Ghana as they come forward. Ghana. Welcome, Ghana, the West African giants, if I say that. Is it true? The West African giants. Let's see. And as Ghana is taking their picture, India should be warming up. So India, a big round of applause to India. He's a hero from India. He's a hero from India.
As you're taking picture, Indonesia is up next. Let's welcome the Indonesian people. Where are they? Yes, up next, Iran. Iran, please. A big round of applause for Iran, please.
And as Iran is taking their picture, Jordan should be warming up. The delegation from Jordan. Jordan.
Oh, yes.
He's a hero. He's a hero from Jordan. As Jordan is warming up, anataka kukaribishwa watu wakubwa wa Kenya. A delegation from Kenya. Delegation from Kenya, and as Kenyans are taking their picture, Lebanon should be warming up. A delegation from Lebanon is up next. A round of applause. As Lebanon is taking their historic picture, Malaysia should be warming up as well. So a round of applause to a delegation from Malaysia.
As Malaysians are taking picture, Mali should be warming up. Les gens du Mali, soyez prêts. Accueillons les gens du Mali. Big round of applause for Mali, please. Mali. Okay, sadly they're not here. Up next, Morocco. Les gens du Maroc. As Morocco, they're taking their picture. Netherlands should warm up. A very big round of applause for Netherlands.
For those who don't know, Netherlands hosts the office of Ipsf. So these are very important people. And no wonder they are a big delegation as well. So another big round of applause for them. And as they are taking their pick, New Zealand should be warming up. So let's welcome New Zealand. A big round of applause as they are coming. It's another big delegation. And as New Zealand is taking their picture, let me ask for a warm-up. So up next is another West African giant, Nigeria. Yes! I expected that. Nigerians are always on swagger. Yeah. Nigeria, you are welcome all. So as Nigeria is taking their photo, then we are asking Pakistan to be warming up. Thank you, Nigeria. So we're calling upon Pakistan, delegation from Pakistan. Is another hero, round of applause. There are two. And Pakistan, as Pakistan is taking their pick, then we're calling upon Philippines. And as a Philippine, Pakistan, done. Palestine. Palestine, big round of applause. Big round of applause for Palestine. He's a hero, 2 meters tall. Yeah, so we call upon Poland.
As Poland they finish taking their picture, Portugal should warm up. A big round of applause for Portugal. A very big delegation. Another big round of applause, please. Very innovative way should add to as the flag. As Portugal, they're taking their picture. Up next, let's welcome Qatar, the delegation for Qatar.
Delegation from Qatar. Big round of applause. As Qatar is taking their pick, Romania should be warming up. A big round of applause for Romania. Wonderful. Wonderful. So as they're taking their photo, let me ask Saudi Arabia to be warming up. So Saudi Arabia. Sorry, they're not here. Let's call upon Singapore. Big round of applause to Singapore. As Singapore is here, Slovenia should be warming up. Slovenia. Wow, big round of applause. It's a big delegation indeed from Slovenia. And as Slovenia is taking their pick, let me ask South Africa to be warming up. Slovenia is a big delegation on high, very photogenic. They're really wonderful. South Africa. That's South Africa. That's South Africa from KwaZulu-Natal and such places. For those of you who don't know, that's an African dance culture for South Africa. As South Africa is taking the pick, South Korea. South Korea.
A very big round of applause for South Korea, please. As they're finished taking their picture, let's welcome Sudan, delegation from Sudan. Another beautiful delegation. Let's give them a big round of applause, please. As they're taking the historical picture, Swaziland, please warm up. Swaziland. When you're too excited, you might have problem holding the flag. This is excitement, people. Let's welcome people from Swaziland. Another hero. As they're finished taking their picture, Sweden should warm up. Let's welcome the delegation from Sweden. As they're finished taking up the picture, Switzerland should warm up. Big round of applause for Switzerland. Another hero in the place.
As Switzerland is taking the pic, Taiwan, big round of applause to Taiwan. RPSA won the bid of hosting this event in Taiwan. So that's also very important to us. Next is Thailand. Big round of applause for Thailand. As Thailand is here, I asked Togo to be warming up.
Accueillons la délégation du Togo. Let's welcome the Togo delegation, please.
Togo is not here. Turkey.
Delegation from Turkey.
Turkey is not here. A delegation from Uganda. One from Uganda. United Republic of Tanzania. Tanzania. Karibuni sana watu wa Tanzania. As Tanzania is here, United States of America should be warming up. A round of applause. Big round of applause as we welcome people from the USA. USA. A big round of applause for the people from USA. As they are here, I'll be asking the last but not the least, Zimbabwe, to be warming up. Zimbabwe. As Zimbabwe is taking their pick, let's also ask United Kingdom to be warming up. United Kingdom. I really put them last hoping they would have a bigger flag than France. Unfortunately, no. Yeah, hope we welcomed all of you. This is official for IPSF. Thank you very much, Secretary General and the President of IPSF. Thank you for officiating this ceremony, now that everyone is welcome in the room.
Of course.
And before they leave, of course, that big country, with
The
a
one and
million
only.
smiles, a million solutions, and 1,000 hills. Can I hear that shout out for Rwanda?
Please, everyone, gather for the picture. Please, everyone. Please, come all. A big round of applause as they make their way, please.
Let us see those 1,000, a million smiles depicted on your faces. Trust me, these are photos you never want to miss. These are photos you never want to miss. Thank you very much. A big round of applause to the President and the Secretary General. So, as we proceed, allow me to also welcome a few people in this room. Professor Pratik Jain, you are welcome to Rwanda. Big round of applause for Professor Pratik Jain. You're welcome to Rwanda. Allow me to welcome Professor Peter Eming and his wife. Big round of applause for such a family that loves us. Allow me to also give a warm welcome to Dr. Franza Kalua. Dr. Franza Kalua from AMREF is here. These are people that you'll probably see on panels and as they give speech and we interact later, but I felt I should also welcome them on a special note. Allow me to give a warm welcome to someone who doesn't know me, but I know him so much. I've always wanted to meet him. I finally saw his face. He's a former president of Rwanda Pharmaceutical Students Association. He's called Patrick Gaparai. I know you don't know my face, but I know you. Welcome to Rwanda. Welcome to your country. You are very welcome. A warm welcome to a honorary member of RPSA and a parent, Professor Kayumba Pierre Carvel. He's a parent of RPSA. You never miss him in RPSA events. For now, I also welcome Dr. Raymond Muganga, the chairperson of the National Pharmacy Council and the senior lecturer in the University of Rwanda. As time goes on, we shall be welcoming more of the people that are already here. But maybe before I leave this podium for now, I will be welcoming more people, but I have seen someone's face, Dr. Victor Moyo from Leaf Pharmaceuticals. Very welcome, very welcome. We are going to have a curtain raiser. We're going to have a curtain raiser panel, very short. Its objective is just to shed light, just to give direction, just to make sure it puts all our objectives in context. This is an event for young people. This is an event for young professionals, particularly pharmacists. So we're going to have a panel that is composed of what really this event is meant for. So it's going to be very short, but you'll see that's very important. So at this moment, I'm going to call upon the moderator for the event, who will then introduce the session for us. Is pharmacist Mandela Pharmacist Mandela, come forward and have the floor. So after this very short panel, I'm going to come back and give you the entire program and how the day is going to be arranged. Thank you very much.
Awesome. Good morning, everyone. Come on. This is a youthful event. I want to hear some energy. Good morning, everyone. Good morning. So in Kinyarwanda, how many of you have learned a few words in Kinyarwanda? Raise of hand. Awesome. This is a very good opportunity for me to teach you something. So when in the morning, you greet Ngaramutse. Yeah? Ngaramutse. All right? Ngaramutse? Awesome. Ngaramutse? Great. My name is Eli Mandela. I currently work with Johnson & Johnson Global Public Health. I'm based here in Rwanda, and I'm a pharmacist. I was also part of the Rwanda Pharmaceutical Association. I'm privileged to be here with you today, and I'll be moderating a curtain raiser composed of very enthusiastic and powerful upcoming leaders. And I would like to welcome my, my panelists. Please, this is not by any order. I would like to welcome Aya Jamal, the president-elect, to please have a seat. Ange Uwase, please have your seat as well. Otiniel Nimbawazi, current chairperson of the African Regional Office for Ipsf, and Dr. Patricia Nyokabi. You're welcome. Okay, I guess it's working. Yeah, you can hear me? Awesome. Like I'm saying, I'm very privileged to be here with you all today. And I can guarantee that 95% of us who are here today were majority youth. And in addition to that, more than 1.8 billion young people are in the world currently. And this is the youngest or the largest population that's this young. So I believe it's quite important that we have this conversation as we're talking about the role of young people in UHC. So I'll start with you, Aya. First of all, I want to give you an opportunity. In 1 minute, you talk about yourself and what you do, and then we'll begin with the questions. Awesome.
Okay, thank you. So my name is Aya Jamal. I am the president-elect for the International Pharmaceutical Student Federation, representing over 99 countries worldwide, and our participants covered over 350,000 pharmacy students. I'm very happy to be here and welcome you all to the Ipsf 65th World Congress in Rwanda, Kigali. Thank you.
Thank you. Good morning, everyone. My name is Otnia Nimbawaz. I'm the chairperson of International Pharmaceutical Student Federation, African region. It represents more than 18 African countries, and with more than 20,000 pharmacy students and recent graduates on the continent of Africa. And we work on different projects regarding to the pharmacy profession development, public health advocacy, and global health policy. So I welcome you also in Kigali, as I'm the chairperson from Rwanda, and also I'm glad to be with you today. Thank you.
Good morning. Good morning. I'm Marie-Ange Uwase. I'm a pharmacist. I graduated from University of Rwanda. I'm the former chairperson of the 4th African Pharmaceutical Symposium, and I have been the Regional Relations Officer of Ipsf Africa Regional Office. I'm currently working at Health Development Initiative as the SRHR Center Coordinator, where I manage all projects related to SRHR. Thank you. SRHR, Sexual and Productive Health and Rights.
Hello, good morning. My name is Patricia Nyokabi. I'm a pharmacist working under the Ministry of Health in Kenya. My previous posting was in the team that was charged with designing the universal health coverage approach, and it's that experience that I hope to bring to this panel today. In addition to that, I've served in IPSF in various positions. I was the chairperson for the 5th IPSF African Pharmaceutical Symposium that was held in 2016 in Mombasa, Kenya. I'm honored to be here. Thank you, Mandela, and the entire reception committee for inviting me today. Thank you.
Awesome. So I told you we have very powerful upcoming young leaders, right? So I'm beginning with you, Aya. IPSF is a leading international advocacy organization specifically for pharmacy students. And I wanted to ask, what role is IPSF currently playing to ensure that young people are involved in the decision-making processes and the policies that affect them the most?
Okay, thank you for your question. Maybe let me give a bit of a brief since we're talking about universal health coverage and we're all young people here, so we're definitely talking about youth engagement in this area of work. So when we talk about universal health coverage and the policy making related to that, we are already talking about engaging the future health workforces who are the leading of this agenda and who are an active role in providing maybe or leading the agenda for health for all. So in IPSF, we're actually covering very main steps of the steps toward universal health coverage. We're working in promotion, we're working in awareness, and we're also providing professional and education opportunities for pharmacists as part of the health workforce. So it is a leading international advocacy, and the work in policy, it is also very important. That's why we're covering area of advocacy and policy. We have a lot of intervention in that regard in terms of providing our stance in high-level meetings, like the World Health Assembly, for example, and providing policy statements that reflects our stance, especially on the area of universal health coverage and health workforces. So we're trying as much as possible to prepare the younger pharmacists and the students to be actually the policy maker of the future or the policy activists who will actually lead the agenda for the universal health coverage to the future.
Thank you very much. So basically you're enabling young people to get on to start the process early so that they are able to, in the future, they can be able to take on that.
Yes, and if I can add, I think for anything related to the health agenda, if you actually want to enforce some change or we want to make something to be improved, whether in UHC or in all health-related agendas, it's very important that you train those health workforces or those policymakers. So we set the agenda, we prepare the young pharmacists, and hopefully when they graduate or when they enter the arena of health and policy making, they are very much educated. And this is an agenda that we have been carrying out, especially this year with the President and the Policy Committee, to make sure that we have a full orientation of what could be actually discussed and how we can lead those agendas in order to be enforced or in order to be heard. And most importantly, to save our seat on the table and to make sure that the pharmacist stance and the pharmacist opinion is there when we're talking about the universal health coverage.
Thank you very much for that. Going to you, Otinia. Africa currently has a young population that's over 65% of the people being under 35. As the chairperson for the African Regional Office, what is happening on your front with the specific context of Africa with regards to UHC and even other areas in healthcare?
Okay, thank you very much. Yes, it's true. Africa is the youngest continent regarding the high percentage of youth representation we have today. As Afro, part of the IPSF, adding to what Jamal we do globally, specifically on our regional level through our members, we do different projects, mainly that goes to the primary health care. So because we work on awareness, we work on early detection of diseases, mainly non-communicable diseases, and also when we get some partners, we go to the SRHR, sexual and reproductive health education. Yes, then with those, with different partners that we may get in the government or non-government organizations, we work on advocating for different agendas, mainly in health. So that's that goes with mainly WHO, and we used to sit at the WHO regional committee meeting We have not yet got some statement there, but this time we are planning to go and sit and have our statement from the project we are doing. Like currently, some of associations were running nationwide campaigns. I cannot, what have been done in Tanzania, they're running an antimicrobial resistance campaign countrywide. Here in Rwanda, they have done a nationwide diabetes awareness campaign, and we have been addressing different challenges or different contexts of how the population sees things. So that's how we get our content, so that from those information I've got for the survey that we have done, we can present it to the policymakers, the government and non-government, so that they can help us push let our voice be heard, so that we can make a change regarding the issues that are found on the ground.
Thank you. And from what I'm understanding from both the panelists that I've just spoken, it's basically there's a lot that's going on that young people are doing. And there are already started initiatives where they're going to the table. And coming back to what some of the challenges that affect most young people, access to sexual and reproductive health and rights is one of the biggest challenges, and particularly when it comes to women and girls. So you mentioned you do work in SRHR, and you're coordinating the activities within HDI. So what role do you see that young people can play to make sure that this access is actually available? Because once again, UHC is the ability for people to have access. So please.
Thank you. Youth can play a big role in the implementation of programs or in development of SRHR policies that can help real young people so that they can have access to universal SRHRs, either services or information. Looking at HDI, what we do, we help young people, we nurture them into becoming advocates. So at HDI, we have a lot of programs. Among them, we have advocacy programs. We have programs that focus on development of SRHR policies together with the Ministry of Health. So young people, if they are really engaged into leadership, if they have the power of decision making, if they have the power of being involved into different domains of SRHR, like development of SRHR policies, designing and implementing SRHR policies and programs, into development or working on needs assessment of young people. So with all those aspects of work combined, young people can really play a big role if we want them to participate in matters that affect their lives, then we will be increasing universal access to SRHR services and information to young people. Thank you.
So also in addition to that, it's basically, there's a lot that's already happening. Young people are doing a lot already. But once again, Dr. Patricia, you're a young person working at the Ministry of Health.
Yes.
You've worked with a technical team for UHC. And universal health coverage is a responsibility primarily for the government to ensure that the people's health as a social contract. Mm-hmm. So what have you been doing, and what do you see young people can actually do to make sure that the governments are able to, one, be able to bring them on board, two, to provide the access, and also make sure that they deliver on what they promised?
And thank you, Mandela. You're right. Universal health coverage is a primary responsibility of governments. I'll give an example of my country. President Uhuru Kenyatta, upon his re-election in 2017, came up with agenda that will be his focus for the next 5 years. And one of them was universal health coverage. And just by that declaration, we got to see a lot of support, both locally and even internationally. One instance that I remember is last year, towards the end of last year, the WHO held its global meeting, the first ever outside Geneva. It was held in Nairobi, just in support of the step that the president had taken. And we had that team, including the Director General, Dr. Tedros, attending the launch of UHC that was held in one of our counties in Kisumu. So it goes to show really the step and the support that is available if the government or the political part plays its role. Coming to your point about how to hold the government accountable, because it's one thing for them to be committed, but it's another thing for them to be accountable, and what role does we as the youth play? So I'm thinking about it in two aspects. Number one, the youth as educated members of the society and what they can do, in addition to what Mary Ange was talking about. We get to see that the youth are doing a lot of things, but it's for the impact to be felt and for the government to recognize that it's not as easy. I'll give an example of one of our counties. It's towards Western Kenya. It's called Migori. We had a group of youth organizing themselves. It's a group called Migori Youth Dialogue. So what they do is they organize parallel discussions to what is happening in their Senate. So whatever the Senate is discussing, the youth are also discussing and giving their input. So they just started it. And then what happened is that so many organizations offered to support in terms of even capacity building, like how do you write bills? How do you approach these governors? How do you write proposals? So it's one thing for us to take a step, and eventually someone will notice and put money into it, and our voice will be heard. That's an example of a model thing that the youth are doing, and actually, even now, it's very hard for that county government to make a decision and not to consult that youth team. Another thing, the second thing is the youth as members of who we are today as health professionals, which is basically everyone seated in this room today, and the role we can play as young pharmacists in making an impact even at government level and government policies. Again, I'll give an example. So in Kenya right now, normally we have the Pharmacy and Poisons Board, which is the regulator of drugs, and then we have the Kenya Bureau of Standards, which is the regulator of food and other consumables. So recently there has been a bill in Parliament to try to merge it into what they're calling the Kenya Food Drug Act. I would presume it's what, for example, they have in the United States, the FDA. So they want to merge that, but already the Pharmacy and Poisons Board and the Kenya Bureau of Standards are overwhelmed as it is. So we as young pharmacists have taken that and we've run with it, and we just trying to get the attention of the government, because they can't pass this as an agenda. It doesn't have to, like, to be the West in everything, that already two bodies exist. So I would encourage us as young people to speak courage fluently, to do whatever it is that we want to do. Eventually someone will notice, and whether it's putting money into it, whether it's supporting us in terms of capacity building, and soon enough, even governments will start to take notice of it. Thank you.
All right, thank you. So once again, things are happening, but there is one more thing that needs to happen. Somebody needs to notice, okay? So from my next question, that was actually going to be, what are some of the barriers that are hindering or are not enabling young people to contribute? So I'll start this way. You start, Patricia, and then.
A barrier, I will say, is bureaucracy, especially from the government point of view. There exists a lot of red tape. You want to talk to someone, the minister or a county leader, but there are so many steps you have to pass through, and I know you agree with me. So the good thing is that we can leverage on technology. Nowadays, we have no excuse. All these ministers and presidents have social media handles. I've seen people responding. You tag them on Twitter and they respond. You post a picture and you see someone has taken action. I remember, again, recently in Kenya, there was a hospital that was closed because a mother was giving birth unattended. So people just posted pictures, and the following day, everyone, including the Minister of Health and the governor for that county, was there. So as much as it's a barrier, it's not as it was 10, 20 years ago. We can leverage on technology. We can post pictures and put hashtags and tag all these people. And soon enough, and with trending topics, they always have pressure to respond. Yes.
Nice. Also, I also want to make sure that the other panelists also add what they think can be done from the young person's perspective.
I agree with Patricia. Yes, bureaucracy plays a big role in hindering youth to participate into different actions that requires decision making. I can also add that there's this mindset that we have that, if I can say old people, let me not use the term old people, but use advisors, that they have that young people cannot really participate, cannot make good decisions. Can we give the youth or young people the space so that they can show us the world? They can do a lot of things. They can make decisions that we may not even think that they can make. So by giving them the space, then they can show us what they are capable of. Let us just give them space, they'll show us the world. Thank you.
Yeah, adding on bureaucracy and the lack of trust, because we don't have enough readers who trust in youth, what they can do, because most of the time when we get youth engaged in some project, youth can be data correctors, this can be people to make the survey. They cannot really understand what we have as ideas to initiate some project or to initiate some innovations. So another challenge that we face most of the time regarding as we are talking about UHC, is capacity building. So most of the youth, they don't know, or they don't have that platform where they can get enough information. One, as there is not enough access to them, but also as youth, we don't engage ourselves to know more what we are required to do or what can be done. So what I think is that we as youth, we need to commit ourselves to work, be in policy making or on other projects that we might have, so we can feel confident ourselves what we can do. We get the information and we can do anything possible that we can be having or any issue.
Okay, so I'll add, we've been always leading the agenda of youth engagement in health, and it's been like for a while now we're trying to advocate that youth should be more engaged, but I think this is the time now that we act nationally, I guess, or locally, because I do think that youth are prepared, and I do think that they have the knowledge, and I do think that they're like higher activists than the current people like working on the health systems or anything. So I think that if they are given the opportunity, they would be able to advocate more, and they will be able actually to be efficient and productive when it comes to policy discussion and policy implementation. So I think the one barrier that I can mention here is just giving them the chance, because we've been, for example, in Ipsf, we've been talking about policy and advocacy, and we've been introducing terminologies like diplomacy, negotiation, how we can actually make our voice heard, and how we can actually approach the high-level people or the stakeholders in the country in order to make ourselves heard. But the barrier is like, and what we hear from our members is that how we can actually reach this point, how we can meet our Minister of Health, how we can actually present the idea that we have. So I think the barrier is basically and simply communication, like just trusting those young people that they have the knowledge, they have the information, and they can actually make change. So I think, I really hope that if we've been here in a high-level meeting and we have people who are actually decision makers and stakeholders, so we can present this idea. But I also do believe that, and I hope that since we're talking about universal health coverage, that the upcoming sessions and the upcoming topics that will be presented to the pharmacists and young graduates here is about how we can actually be part of the systems, and how we can actually improve the programs or the policies or the curricula in the university to maybe accommodate more youth or engage more youth, or make them more involved in the decision making and the idea spreading. So I think this is the main part, simply communication, and I really hope that we're moving this step, and we're not, and like for the upcoming future, we're not advocating for youth engagement anymore, but we're also advocating for how they can actually be active role models or active players when it comes to the health system strengthening, or the health agenda, or the global health agenda. Yeah.
Thank you very much. From what I've heard, one is actually being able to get the space to show what they can, the bureaucracies that are out there, the communication, and also being provided, being invited and looked at as people who are capable of doing things. Being able to be provided the ear, the listening ear, so that they can share their ideas. So I do not want to ask all the questions. I want to take 2 questions from the audience, just 2 questions. So the first 2 hands that shoot up, I'll take those. One already. I want to have a second one. Two. Thank you.
Good morning to the House at large. Mr. Othniel, okay, first I would like to congratulate the speakers. You've deliberated on a lot of things I wanted to ask. I just have a misunderstanding when you say there is also lack of capacity building. What do you mean by that? Thank you.
Thanks very much. My question, before I deliberate quickly on my question, I've heard the panelists have actually alluded on very important issues, the issue of the bureau and how the space is limited for young individuals to in fact voice out. Because we normally say too much regulations prevent innovation, but less or little regulation, it exposes people to danger. So with that being said, I needed to find what's the position from the pharmacists who are already in the profession in terms of the national healthcare coverage and the fourth industrial revolution. How have we in fact positioned ourselves regarding that? Because we really can't avoid the fourth industrial revolution in every space of the healthcare system. So I needed to find out from our panelists what's their view regarding the national paving their way toward the universal healthcare coverage and the fourth industrial revolution.
The first question.
Thank you. When I said the lack of capacity building is that we're young professionals. We have got our bachelor. We're still pursuing a bachelor in pharmacy and any other field. So we're having those skills as professionals for a certain field. So when I'm talking about the lack of capacity building, it means if we need to make our voice heard, how we make the approaches maybe to reach to the policymakers, because we have found that we have the challenges of the bureaucracy when we try to approach, but also we still lack sometimes those skills that need us to be on the table. So that how can we address certain challenges? How can we make our voice heard, or how can we propose some solutions? So sometimes we are knowledgeable with the field that we're in, but when we tend to make it global, to make it being heard on the policy level, we come with that challenge. So that's why we need to get some capacity building on that. So when we are being able to address a certain challenge, we can be able to address it properly or tell in the terms that the people in the policy making can be able to understand. Thank you.
So anybody else who wants to take on the other question, please?
I may add one point maybe. Well, when we talk about universal health coverage, we're basically talking about human rights and like fighting inequalities and trying to provide opportunity for everyone, and the health for all agenda that we are always advocating for. So I think I will take it from Ipsf part, because I think like the younger pharmacists or our members are very much equipped with all these skills and knowledge that they need in order to be part of the UHC agenda or the discussion. We like if we talked about the steps as I mentioned previously, we're engaged in the part of the promotion, we're engaged in the part of the awareness, and we're also engaged with the part of the advocacy and policy. Those are the skills that you might actually use in order to be active agent or active roles in advocating for the universal health coverage. And I do think that it needs to be taken locally, and it needs to be enforced locally in terms of policies and in terms of providing the suitable systems for the pharmacists locally and nationally to be graduated as the policymakers or the UHC activists or the key roles in this area. So I think that we're very much covering those areas, and we're very much providing the information needed, and it's just about the right accommodation for the youth locally and nationally to be actually able to apply those skills that they gain.
Adding to what Othniel has mentioned about capacity building for young people, I would like to give you an example of where I work. So I'm almost the youngest person at where I work. And as I told you, we work on SRHR. We have different programs, but my main focus is on SRHR. And when it comes to policies, when I attend different meetings, technical working meetings on family planning or adolescent SRHR, I realized that I was the only young person who was attending the meetings. Or others were old. I don't use the term old, but I'll be using advisors. Others are advisors. And I was the only youngest person there. And imagine they are making decisions that will affect young people, that will affect adolescents. And the advisors are the ones taking those decisions. What about adolescents' participation? What about young people's participation? And again, I couldn't attend those meetings if I was not trained or formed enough regarding SRHR policies and programs. Of course, I have to have that capacity built in me so that I can advocate for what I want young people to achieve or to have access to. And again, I'm a pharmacist. Of course, I have to participate in all those different fields. As pharmacists, we sometimes ignore the field of policies or policies development, policies designing, policies implementation. But again, it's up to us. If we don't participate, other people will participate for us, and they will make decisions that are not convenient for us. And when about the second question of paving the way towards universal health coverage, again, using that example, at Health Development Initiative, we realized that young people do not have access to SRHR information and services. They have access to, but not in enough way. What did we do as HDI? We provide information and services for free for all communities who are coming to our offices. We have a kind of clinic that provides all SRHR information and services that young people may need. Why do we provide them for free? Again, this comes the cost of services, healthcare services that are provided to young people. Sometimes they can't afford those services. But what do we do as HDI? We provide them for free. This is, again, the universal health coverage that is focused on. Thank you so much.
I've been just told that I still have space to take 3 more questions. I want to have a few questions from this side and then, okay, I already have 1. 2. I want questions from this side. I'm going to impose. Questions from this side? Okay. We have a question from this side. All right. So we have 3 questions. Start by him.
Good morning. Thank you for the opportunity. My question is mainly based on sexual reproductive health, especially to the young people. It has been a challenge in a lot of countries, mainly in Africa, in terms of the financial capacity that the different countries have in terms of provision of this kind of services. And you stated that the services are actually provided for free where you are actually based. But then I was just asking, what are the proposed methods or strategies to actually improve the access, even in less privileged countries, that you may have actually come about, at the same time addressing the fact that we are not all financially stable or financially capacitated to provide free sexual reproductive health. So I just wanted to get your take on that one. Thank you.
Morning, everyone. Thank you very much. When I was getting the information from the panelists, I got a point from Otinier, which was really addressing the capacity building, and he told us we are mainly used to look the way of building the capacity of decision making. And for me, you see, we are used to have like workshops, like a conference like these ones, and maybe he told us that in Afro region of Ipsf they used to have a project they're working on. And I'm asking myself, Otinier, why do you think is the lack of this capacity building unless we have like all a part of this which we are used to acquire knowledge from? Thank you very much.
Thank you very much, the panelists. Looking at the title of this panel itself, Our Stake in UHC, and looking at the caliber and the nature of this event, we are having an event with students, young professionals, but also seniors who are here, who are going to be as speakers and so. I'd like to hear from you, how should me as a student or any other person who has come to attend this event position myself, which kind of package do I need to really grab from these people that are here, the seniors and so on, so that can help me be in a better position to contribute to universal health coverage. So how better can we really use these people here, and so that in the end it's not a blame game. It's not, they don't trust us, they don't believe in us, but they are actually equipping us to deliver to universal health coverage. Thank you.
All right, please take those on. We'll start with the very first question around SRHR.
Yes, on the first question about SRHR, with where mentioned financial capacity, which limits access to SRHR services. Yes, it happens a lot. With the WHO report of 2018, they showed that 39 million of young people aged between 15 to 19 years old, they were impregnated, so they got pregnant. And 16 million of them, they give birth. What about the rest? Maybe they performed unsafe abortion. Maybe they couldn't give birth. So this shows us how really we need to invest into SRHR. This is not the work of one person. This is not the work of one organization. This is not the work of one country. This requires partnership. Partnership with different countries, partnership with different organizations, so that we can all ensure that there is universal access to SRHR services and information. Again, this requires networking. If you are here as a student, if you are here as a young professional, you need to ensure that at least you leave this place with 2 or 3 networks that can help you in the future for you to achieve what you want. And again, this what we have achieved as HDI. We try to network with different organizations working on SRHR. We're trying to learn from them. How do they do it? And also something else that we have to emphasize on is advocacy. You can't do advocacy without the needs assessment. The needs that are in Rwanda are not the same as the needs that are in Kenya. The needs that are in Burkina Faso are not the same as the needs that are in Palestine. Then we all have to know, how do we assess the needs of young people so that they can have access to SRHR services and information. I give you for information, so in Rwanda, a few months ago, in April, there was the ministerial order around abortion that was developed, and it's now official. Of course, there's some exemptions about it, but why was it developed? They realized that there is a need of safe abortion in Rwanda. It's not legal. There are some exemptions, yes, of course, but they realized that there is still a need of having safe abortion for some cases. That's why they made that ministerial order around abortion. Now, there are other things that we can advocate for. Nowadays, we are having different discussions on how adolescents or young people can have access to family planning methods, to contraceptives. Why? Maybe in Kenya they don't realize that need, or maybe they don't need family planning method. Adolescents and young people from Kenya, they don't need family planning methods. But in Rwanda, we are realizing that young people are now sexually active, and many of them are getting pregnant. Then they need family planning methods. So discussions are going on. We are also trying to see if we can advocate for that, so that adolescents can have access to family planning methods. Of course, as I said, it requires advocacy, partnership, networking, so that we can achieve the universal access to SRHR services and information.
Regarding the question that has been addressed to me, I can say that people who are in Ipsf, they're lucky because we're having the capacity building. We do the readers and the training where we can get different trainings on diplomacy and negotiation. We do have online policy making trainings. We do have webinars. So that's or everyone who had participated, they get some knowledge as we're discussing about the capacity building. But I raised this point because it's not only us IPSF who are paying this load for you to be part of UHC. We need everyone to be on board so that we can have all points or issues youth they are facing to be addressed. So we need not only people who have got chance like us to be in IPSF or to be in the federation where we can acquire all those information, but we can look also outside, people who are outside the federation. How can their voice be heard, or how can their challenges be addressed? So that's where we are saying like there's some capacity building for some groups, but also we need to have everyone acquire all those skills or all those information that are needed to address the challenges youth are facing, or also as UHC globally. Thank you.
In response to the question that was asked by Jeffrey concerning we as young professionals or students, and what package can we get from the older people, I'm just calling them the advisors. The package that I will say is information. We really can't downplay that they've been there for longer, they have all the experience that we don't have. We can't, we are millennials, we want to occupy their positions very fast, but really there's a process. So what I will say is get information. I've noticed, even through my experience, that the older people are usually very able and willing to mentor. I think it's the approach that we as young people take. I will say even the position that I got in the UHC Secretariat, it's because of the networks I'd made, and it's because of my experience in IPSF. It gives you a better position compared to someone who has none of that. It puts you at a better place, even when you're approaching these people. And really, they make these positions available for you as long as you're willing and ready to learn from them. Thank you.
I would really like you to comment on this.
Okay, so one advice that I can actually give is that we're hoping that this conference or this symposium will be diverse and it will cover a lot of areas. So what I expect from the participant is to grasp what you think it's a gap on your local association or your country, and try to address this as much as possible. And I really hope that for future, we're gonna have this seat at the table, we're gonna have our voice being heard, and we're gonna have the pharmaceutical stance being there on the global health agenda. So I think those type of conferences that we organize and those type of events and symposium is to give information and try to choose the information that would actually serve your cause or serve your country or serve your personal agenda when it comes to improving the health system locally or nationally, or even globally, or when it comes to strengthening your health system in the country. So I think is information to add, and also to try to address what the gaps that you need to work on and what are the opportunities that you can actually gain from this event.
Thank you. Thank you. So once again, I haven't had any questions from here. I want to give them another chance to give me 2 more questions. Please, we want to hear from this side as well. Yes, you have a question? Second person? All right, we have a second person here.
Good morning, my name is Nelly, and still basing on the theme of this session, I wanted to ask, what are the opportunities that young people have so that they can be active in the process of achieving UHC? What are the opportunities and the challenges so that they can know how to act? Thank you.
Good question is right here in front.
Okay, hello, I'm Alison from Singapore. And so my question is, so you all have been talking about advocating and approaching the government to share our point of view. So my question is, what is the cost in pursuing universal health coverage in the perspective of not just the government, but what about the other stakeholders that are involved in the provision of healthcare? So be it, for example, Mr. Eli Mandela, you mentioned that you're from Johnson & Johnson, right? So what about pharmaceutical companies? So when we state that we want to approach universal health coverage, what does it really entail? And what is the barriers so the barriers for us is relating to the government, but what about the barriers that the government is facing, as well as the other stakeholders? Yeah.
Somebody go fast. Yeah.
I can address both points very fast. For the other one about opportunities, I would say you're here now. This is one opportunity that you can make use of, for sure. Those type of meetings that we organize or you might attend, those type of events, those are all opportunities that you can actually make yourself exposed as a young pharmacist and try to gain as much information as possible, yes, but also this is a way of or a tool for you to communicate and approach those people or those stakeholders who you think might serve your agenda or serve your cause. So I would consider gatherings like these and events like this is an opportunity that young pharmacists and especially members in Ipsf can make use of. This is very fast. I'm sure the other speakers have adding points to that. But for the other question about other stakeholders, yes. We're now, for example, locally, I've been working on health policy and health in all policy. For now, we're not talking about, for example, the Ministry of Health that is mainly concerned with the health. We're now talking about the private sector. We're talking about the civil society organizations. We're talking about the other ministries. So it's not about health policy anymore. It's the concept is about health in all policies. So, and it's the same thing as social determinants of health. So if you're anything that is affecting the health, anything that is affecting the agenda that is concerned with health, it's considered as stakeholders of concern to you as a health practitioner or a health workforce. So definitely it's not only about Ministry of Health. All entities are considered as stakeholders that needs to be approached based on the plan that you have and based on the agenda and based on the gaps, as I mentioned before, on your country that you need to cover. So this is a very interesting point, and this is actually a very important point when it comes to who do we need to work on and who do we need to approach, because it's not always about the Minister of Health. This is one example that I use, but based on what you have or based on the gap that you have, you need to consider who are the other stakeholders that we need to approach. For example, private sector, because I need fund for a specific thing. For example, Ministry of Economic, because it is somehow connected when it comes to health and economy of the country and anything. So this is definitely one important point that it needs to be addressed also when we talk about young people being served as activists, because the agenda of health in all policies, it's very important when we talk about advocating and trying to move with the global health agenda or local agenda.
So, well, I'll take this opportunity to also shed some light on what we do at Johnson & Johnson. And the organization I work for is called Johnson & Johnson Global Public Health. And its existence is basically enabling the least privileged people to have access to the technology that Johnson & Johnson has. So the specific program that we have here in Rwanda is around mental health. And we are helping the government to, one, enable access to the medication, the innovative medications that we have, and be able to afford that medication. And the question that you asked about, what is the cost? There is a very good definition or how WHO explains what UHC is not, and that's basically UHC does not mean free coverage for all possible health interventions regardless of the cost, and as no country can possibly provide all the services in a sustainable manner. So I definitely do agree with you. It needs a lot of stakeholders to be involved in this process. Yeah, so I try to, I guess, Johnson & Johnson, what we're doing is basically enabling the access to the innovative medications that we have. So while closing up this panel, I would like to give 1 minute to each panelist to give us a closing word, and then we can end here. You want to start, Dr. Patricia?
Okay. My closing remark is that UHC is a social justice issue. It's equity, not equality. Usually we have a population that has always been left behind. UHC cannot be achieved if we continue leaving this population behind, which includes the youth, the women. This has to be incorporated for us to realize UHC. Thank you.
My closing remarks please, you can clap for her. My closing remarks is that as young people, as youth, we should get informed, network, and grab opportunities for us to achieve universal health coverage. Thank you.
Round of applause.
My point is that youth, we can be part of the game and have change made. And what I can say is that what we need to do is to use all the opportunities that we're having, or the platforms we're having to acquire knowledge, so that we can use them being on the platform for our policy making, or for advocating or our agendas regarding youth and also universal health coverage globally. Thank you.
Yeah, I would basically add to what the other said, is that stay engaged, stay informed, and I'm sure that we have the skills needed to be active in the policy making and policy discussion, and hopefully in the future we will have our seat on the table and make sure that the pharmaceutical field has its own part and its own agenda in the global health agenda.
Thank you. Thank you very much. So basically, it's equity, not equality. Be informed, get involved, and be knowledgeable. A very huge round of applause for these panelists as we end our first session. Thank you very much.
Thank you very much. Another big round of applause to the panelists and the moderator. I hope that was really fulfilling. I hope we now really have light of what we are here to discuss and what we are here to achieve. This was really amazing. And I do believe, I have always told the senior professionals that such panels give hope for sustainability. Thank you very much. All the speakers were awesome. The moderator was wonderful. So I believe we are safe and we are good to go for this event. Thank you very much once again.
Yes, I would like to add, I hope this has been an inspiring panel, because I would like to add that even though we are young people, we are young profession in all these different areas, either medicine or pharmacy, whatever that you're into, that you feel inspired to use your voice, because you do have your voice. And this is an opportunity you can really learn from.
Yeah, moving forward, I do believe in the program we are going to have more young people sharing panels and other presentations in the workshops, so that really we make sure we're learning from the seniors, and we make sure the future is bright. The future is ours. So I'd like to fill you in with what is next. So we're going to have an opening ceremony. In a few minutes, the guest of honor is going to be arriving. So when the guest of honor arrives, we shall all rise up, welcome them. Then they'll have their seats together with other people who will be giving their speeches during the opening ceremony. Then after the opening ceremony, the speeches, we're going to have a photo session, which will be comprised of a few people that will be mentioned when that session comes. After that, then we're going to have another big and interesting panel of the day. And then after that panel, we shall break off for lunch, after which we shall have parallel sessions. And the 3 parallel sessions that will be happening at the same time will be in the following rooms. This very room, MH4, for those of you who have not read at the entrance, this is MH4. MH4 after lunch is going to host a panel from 2 to 3:30. And that panel is engaging all stakeholders for robust healthcare systems. So that panel is going to be here for those who selected that panel. Another room to be used is AD12, is on the right as you move out, is on the right. AD12 is going to have a town hall session. It's going to have a town hall session with a topic, research and development, a cornerstone for all healthcare aspects. So it's on the right.
Yes, and the third panel that we'll be having, it's in room AD10, also same direction as the previous room. And panel 2 will be under the theme of Developing Human Capital Index, a new approach to achieving SDGs through young professionals.
That is from 2 to 3:30. Then from 3:30 to 4, there's going to be a short health break. After that short health break, we are going to have other 3 parallel sessions, which are also panels. In MH4, here, we're going to have health commodity supply chain towards the hard-to-reach population. And then in the same room, AD12, we're going to have climate change, instrumental towards health for all. And
in AD10, we'll be having people-centered healthcare delivery with focus on women and girls. So make sure you choose very wisely the one you want to follow. And as we go for breaks, take a look at where the holes are going to be so that you don't waste any time when it's about to start.
Yes. Like I told you, let's make noise, let's shout on social media, let's make the world know. We are using a Twitter handle. The hashtag is IPSF World Congress 2019. In short form, it's IPSF WC 2019. As you can see there, I hope all of you guys have earlier noticed the password for Wi-Fi, so we're good to make the world understand what we are doing here. So in a moment, I and my co-MC, we're going to be recognizing the sponsors and partners of this event. But before that, I'd like to recognize another group of important people seated right in front of me. And this is the IPSF Exco. Could you please rise up and wave to the audience? IPSF Executive Committee. Yeah, these are the icons behind the existence of such a the biggest student-led organization. And it's been there. It's the 70th anniversary, 65 World Congresses in a row. Guys, another round of applause for these important people. So I'll ask her to start by recognizing the sponsors and partners of this event.
Yes, we have very important people without whom all of this would not be possible. So we'd like to give them a very big recognition for what they've done and what they continue to do. So as we mention them, please feel free to let them know and shout as well as you can. We do have the Rwanda Convention Bureau that is responsible for hosting us right here where we are at the Kigali Convention Center. So please, a big round of applause for them. They are responsible for these beautiful and wonderful halls we'll be using. We also have
Chemonics. Big round of applause for Chemonics. A big round of applause. They're actually here with us. You'll be interacting with these people. In some of the sessions, you see them here. A big round of applause for Management Health Sciences for Health, MSH.
We also like to recognize USAID.
Health Development Initiative, HDI. You already saw Ange speaking here, but also others will be sharing with us from from HDI, apart from Ange. We also have Annabelle. Round of applause for Annabelle.
A big round of applause also for Society for Family Health, SFH. Also, big shout out to Clinton Health Access Initiative.
Yeah, this event is also in partnership with World Health Organization, the country office. We also have UNFPA. Another big round of applause for UNICEF as well.
Another big round of applause for AMREF. I believe we do have a representative for AMREF. Another big round of applause for RBC, that is Rwanda Biomedical Center. A big thanks also to Kenya Airways that continue to support us.
Then let's also recognize Lee Pharmaceuticals. Big round of applause. Another big round of applause for Babil Digital Health Services. Partners in Health. Rwanda Social Security Board, RSSB.
Another big round of applause also for Sulfo Rwanda. Big thanks also to GSK, MSD, Africa Medical Supplier. A big thanks also to Rwanda NCD Alliance.
We'd like to recognize the support from the city of Kigali, Bufmal, and last but not the least, Experience Laboratories. So these were really instrumental in making sure this event is a success, and they will continue to be with us either as speakers or as contributors in a number of other sessions. So feel free if you meet anyone. You never know. I always tell people, if you're a student, a young professional, you're in an event like this one, you never know. It could be the place where you are getting your next job. You never know. I know a number of my colleagues who got their jobs from the network. They just heard from here. So make sure you interact with these people. Let's welcome the Vice Chancellor of the University of Rwanda, Professor Philip Cotton. Professor Philip Cotton is a honorary youth. So as you see him around, know you are with a fellow youth. So he's a honorary youth. So we always honored to have you, Professor. At this moment, as an IPSF thing, you know what that means as IPSF. You don't have to sit for more than 2 hours. Yeah? I'd like to call upon here a familiar face, Mr. Eli Mandela. I've been getting messages through that you did well as a moderator, so we want more from you now. I've been getting messages through that the moderator did very well. Yes? So we need more from you. Come forth. Let's have an icebreaker from Eli Mandela. We're going to have an icebreaker. We're going to have an energizer. And after Mandela, I want to also challenge someone from IPSF to give us another one. So you are big people. I'm not going to ambush anyone. Just think about it. Come up with someone who is going to show us what IPSF has for us. Thank you. I like that. Mandela, over to you.
Wow. This is a very difficult job to do. So before I start, I would like to request everybody to stand up. Please. And in that spirit, I would like to invite Mr. Otniel as well. How many of you have been to Japan? Nice. Have you heard of the samurai there? The samurai, the ninjas. Heard of them? Yeah? What do you know about them? Nice. They use swords. Yeah? So I want us to do a few activities using our swords. Okay? Otniel, please. We've been together in Japan, so... Okay, no worries. So, well, if there's anyone from Japan here, please forgive me. I might use the wrong terminology. Yeah? Bear with me. But I'll try. Yeah? Yeah, everybody, you have, well, They have a sword. Everybody hold the sword, please. Okay, so you have a sword? Okay, now, hold it with one hand. With one hand. Yeah? Then you're going to pull back with both hands, okay? When you pull back, you hold it, okay? Say, ooh. Yeah? Ready? Let's start again. Ooh. Ayaya. Amuchi, muchi, muchi. Awoshi, woshi, woshi. Ooh. Ya, ya, ya. Do you all understand this? Ready? Let's do this again. Your sword. Ooh. Ayaya. Amuchi, muchi, muchi. Awushi, wushi, wushi. Ooh. Yeah, yeah, yeah. A round of applause to all of you.
Okay. Ready? The Ipsf one? You ready? An energizer. An energizer from the Ipsf school.
How many times do I have? How many times do I have? Times. Okay. Hi, everyone. I'm Daniel, chair of PE. So, for those of you who've been to Argentina last year, you might know what I'm going to do, because this is what I'm a bit famous of. But for those of you who didn't come last year, so this is an energizer that I ate this morning. So it's called the banana. So I want everyone to stand up with me and follow my lead. So the first one is like peel, banana, peel, banana. And the second one is slice, banana, slice, banana. And the third one is shake, banana, shake, banana. And the last one is eat, banana, eat, banana. So repeat after me. The first one, we do what with the banana? Peel. We peel it first. And then the second one, what we do with the banana? And then the third one? No, shake. And then the last one? Okay, let's do it together. 1, 2, 3. Peel, banana, peel, banana. Slice, banana, slice, banana. Shake, banana, shake, banana. Eat, banana, eat, banana. One more time, faster. Peel, banana, peel, banana. Slice, banana, slice, banana. Shake, banana, shake, banana. Eat, banana, eat, banana. Last time, faster. Peel, banana, peel, banana. Slice, banana, slice, banana. Shake, banana, shake, banana. Eat, banana, eat, banana. Thank you, everyone.
Another big round of applause for him, please. That was amazing. As you can see, in IPSF, we do have sons and daughters with a lot of talents and gifts. So we're very happy to have them all here. In a few minutes, we'll be welcoming our guest of honor. And as my co-MC mentioned, as she makes her entrance, we all stand to welcome her. And then after that, we'll be welcoming them here in front to give the speeches for the opening ceremony. Okay?
Yeah, so like we said, anytime the guest of honor enters here, we shall all rise up. And at that very moment, we're going to have people who are supposed to give their speeches all sit in front. And those are the president of IPSF, the chairperson of reception committee, then the vice chancellor and the guest of honor. So they are going to be entering in a moment. But before they come, I hope you guys have enjoyed these icebreakers. And for those of you who've just attended for the first time, like I told you, this is mostly what IPSF is for, and it's that enjoyable normally all the time. And the preceding days are going to be like that. So when you're here, the slogan for IPSF in events is study hard, party hard, sleeping is not an option. I hope it is still so, right? Sleeping is not an option. We've probably slept for, I don't know, the entire period of the year. So this is the time you need to spend the whole week up and running. You want to see how possible it can be. But it's possible with IPSF, of course. Yeah, so I believe you guys are going to enjoy. Before the guest of honor enters here, I'd like to also mention that tonight, we're going to have a number of night events. So tonight is the welcoming dinner that is going to happen at your hotels. So there's also going to be others throughout the week, international night, Kigali night. It's going to be also the Rwandan night. I really promise you'll be happy. You'll be happy and you'll enjoy. So just make sure you're as free and ready to absorb everything. So that's why I tell you that honestly, sleeping is not going to be an option. Probably the rooms that were given to you were for you to keep your suitcases there. Otherwise, sleeping is not an option. Also to fill you in, when you are while in Kigali, while you are traveling around, or even those who want to go up country to the national parks and zoos and lakes, Kigali is safe as you're traveling. Just make sure you as the place is safe for you, you are also safe for the environment. Yeah? So make sure you're secure. The place is secure for you. Make sure you're also secure for the environment, okay? Otherwise, everything is going to be fine. Whenever you meet anyone, politely ask them any service. They are good. If after giving you a service, just tell them, murakoze. Okay? Murakoze is to say thank you. And if you meet them in the evening, don't tell them what Mandela just told you, mwaramutse, because that is going to be good morning. In the evening, just tell them, ngiriwe. Then life continues, okay? For those of you who have been here for the last 3 days or so, I hope you have already enjoyed the breeze of Kigali. It's as green as you can see. Even if it's a dry season as it is, Kigali is always green and having good air for breathing. Yeah? So once again, from RPSA extends its warm welcome to all the official delegates that are here from different countries. And the rest of the delegates also are going to be with us through this event. So as the official delegates start switching on to the General Assembly, which is the highest decision-making body of IPSF, the rest are also going to be engaged in different sessions and different activities. So rest assured, you are not going to be bored in Kigali. For this event, you are not going to be at all. Okay?
Also, make sure you stay connected with social media, whatever platform you use, either Twitter or if it's Snapchat or it's Instagram, I don't care, whatever you use, with the hashtag that we shared, IPSFWC 2019. Please share as much as you can, and we're streaming live. Let's make noise around the world, okay? Thank you.
So in the meantime, be greeting your neighbor, and in a few minutes, I'll be letting you know that the guest of honor is entering. So be greeting your neighbor, pick their business card if you haven't, or their contacts. Please make sure by the time you leave here, you have at least 10 of the new people you have known. So let's remain here as we exchange, as we interact with our colleagues. And in a few minutes, we are going to be welcoming the guest of honor. Thank you.
Last night I had a dream. My baby won't ride with me.
So let's settle in our seats, guys. The guest of honor is entering.
Last night I had a dream.
So let's have our seats unless you're really having anything urgent. Let's remain in our seats. Let's remain calm. Let's remain calm. It's another important moment. The opening ceremony is really important.
Since you left me.
Let's get back to our seats
I used to be.
as we get ready for the guest of honor.
Many days, many nights.
Let's remain calm. Let's remain seated.
I see the same dream, baby. Many days, many nights. I see the same dream.
So,
Oh Lord, since you
people
left
outside,
me.
please get in.
Ain't no man I used to be.
Let's get in. Let's rise up as we welcome the guest of honor. Let's all rise up. Let's all rise up as we welcome the guest of honor. Let's all rise up as we welcome the guest of honor. The guest of honor is here. Now that the guest of honor is here, right, you can have your seats.
Thank you, everyone. Thank you, everyone. Honorable Minister of Health, we would like to welcome you to the 65th Ipsf World Congress 2019 here at the Kigali Convention Center. We are very happy and honored as Rwanda to be hosting it for the first time ever here. It's our great pleasure. And we have delegations from 51 countries all over the world, all present here in this hall. This World Congress will be conducted under the theme of paving the way towards universal health coverage through young professionals.
Let me also take this opportunity to welcome the guest of honor, the Honorable Minister of Health, Dr. Diane Gashumba. Standing in front of you is Geoffrey Bayingana. I'm a pharmacist and a recent graduate from the University of Rwanda. I'm together with my colleague,
Igabe Alida Sabrina, also a recent graduate from pharmacy from Mount Kenya University.
Yeah, like my colleague just said, the theme of this event is paving the way to universal health coverage through young professionals. It is important and imperative that we had this discussed in this event with all the delegates from more than 50 countries to talk about universal health coverage, which is a movement as it's an agenda as described by World Health Organization that really puts an emphasis on the World Health Organization Constitution as per 1948 that determined health care as a human right. It was again emphasized in Alma Ata in 1978 at the time when the primary health care agenda was developed. Universal health coverage has three major objectives, which is equity in access to health services. Everyone who needs services should get them, not only those who can pay for them. So it should be affordable in that way. Also, the equality of health services should be good enough and to improve health care and health services. People should all be protected against any financial harm in attaining their health services. So universal health coverage is an agenda that does not necessarily ask who can afford health care, but it asks who cannot afford health care, and we start with those ones. So without any further ado, I would like to welcome 4 people in front here, and we ask them to officiate this opening ceremony. I will ask the president of IPSF to come forward, Ms. Petra Oric. I
Big round of applause for her.
Also, Jean Dodier, the chairperson of reception committee, to come forward. I'll call Professor Philip Cotton. And most importantly, I call upon our guest of honor to take the seat. You are welcome. A big round of applause as they take their seats, guys. Thank you very much for gracing this event. My mandate is shrinking somehow. Allow me to welcome the president of International Pharmaceutical Students Federation to give her welcoming remarks. Petra, you're welcome.
Thank you very much, Jeffrey. Ladies and gentlemen, honorary guests, dear IPSF members, on behalf of the Executive Committee of IPSF, it is my great pleasure to welcome you to the 65th IPSF World Congress in Kigali, Rwanda. IPSF has always been a platform for sharing knowledge, experiences, and ideas, building networks, and has provided opportunity for education, professional development, and international exchange. As pharmacists, we must strive to continuously develop our profession to meet the healthcare needs of the future and respond to the challenges of today with expansion of the roles and services. Throughout this Congress, during lectures, workshops, General Assembly, competitions, we will have the chance to explore the innovations in pharmacy and pharmaceutical sciences, advocate for health promotion, and develop necessary set of skills for achieving health for all. This year, it is very special for IPSF. We are marking the 70th IPSF anniversary, celebrating all the achievements, hard work, and passion of many generations of pharmacy and pharmaceutical science students and recent graduates who have contributed to its development and expansion. From 1949 until now, we have grown from a federation from only 8 member organizations to that of 110 organizations representing more than 350,000 members from 90 countries worldwide. This is such a great achievement. Please allow me now to introduce my beloved team who has been working the whole year with me, the IPSF Executive Committee. I would kindly ask you to just come in front. So first we have Ms. Aya Jamal, President-elect of IPSF. Teresa Chervinkova, Secretary General. Shihab Bedin Zadana, Chairperson of Internal Relations. Rami Chablain, Chairperson of Media and Publication. Daniel Semi, Chairperson of Pharmacy Education. Jacinta Barbosa, Chairperson of Professional Development. Osama Madadi, Chairperson of Student Exchange. Otniel Nimbabazi, Chairperson of African Regional Office. Yung Yung Choi, Chairperson of Asia Pacific Regional Office. Ahmed El Ouveni, Chairperson of Eastern Mediterranean Regional Office. And Jean de Dieu Iradukunda, the Chairperson of the 65th IPSF World Congress. Please give them a big round of applause. Also, I would like to mention the Executive Committee members who unfortunately could not join us. So Roland Bensad, IPSF Treasurer, Carolina Miljak, Chairperson of External Relations, Sija Ong, Chairperson of Public Health, Katarina Bacevic, Chairperson of European Regional Office, and Austin Green, Chairperson of Pan American Regional Office. Please, a big applause for them as well. You would see these guys in these days more. Don't hesitate to approach them because those are the leaders of the Federation. Thank you. Lastly, I want you to make sure that you get involved, discover unique opportunities, broaden your mind, and make friends for a lifetime. This Congress is a great platform for you to show all the energy of youth, pharmacists, passion from the profession, and patience, and motivation to change the world. So let the Congress be just the beginning of the exciting journey of transforming pharmacy and pharmaceutical sciences. Thank you.
Good morning, everyone. Sorry for my voice. Honorable Minister, Dr. Diane Gashumba, our one and only Professor Cotton, the Vice Chancellor of the University of Rwanda, the National Pharmacy Council Chairperson, all honorary guests, ladies and gentlemen, dear IPSF members. It's our great pleasure to host you today for the 65th IPSF World Congress. We're much excited that in the past 2 years, we were able to win the bid to host you here in Kigali for this best place of the 70th IPSF anniversary. So under the theme, Paving the Way Towards Universal Health Coverage Through Young Professionals, we're much excited to host you today. The theme was much crucial to this event, graced by our Minister of Health. The whole World Health Organization proposes the concept of universal health coverage as a single overarching health goal for the comprehensive agenda for the SDGs set out by all UN member countries. The SDGs include a myriad of targets across different sectors, as you know, but UHC is defined as a situation where all people who need health services receive them without undue financial hardship. This UHC goals achievements is a gleam of triumph for the more robust global world. The new agenda is transformative, and the new agenda is universal. It renders socio-economic and environmentally sustainable development highly relevant for all countries around the world. For the SDGs to be sustainable, it is within the exclusive purview of young citizens of the world, and especially young healthcare professionals as young pharmacists gathered here in the particular instance of UHC. If we envision a considerable stake for the present, but also for the future of our globe, we should think about bringing changes and putting energy into a development in which young citizens of the world have the right to participate. In addition to the whole worthwhile nature of the agenda as a whole, a continued and bold encouragement on youth participation and investment in youth or rights of young people is paramount. Given recent trends which have sparked increased interest in ways to improve the primary care sector with greater opportunities for community-based approaches, young people are preponderant drivers of change in their local communities. Young pharmacists, as in our case, given the easy public access to the pharmacies, they can sustain everything if well engaged. In areas that pertain clear impact to young people, there's need for more vivid mechanisms of participation through decision-making. When political space is not an option, the youth works for social development through activism, social movements, or other creative expressions. So at times when young professionals are involved in some parts of the world, it's still a privilege. But in some countries like mine, we are privileged to be deeply involved. So young people have a role in engaging people at the grassroots level and a role in communicating the goals to a wider society. That's why we are much privileged to talk about this great theme. I thank you all and wish you fruitful discussions in the next 7 days. Thank you so much. To this end, I would like to welcome my Vice Chancellor, Professor Cotton, to give us a small remarks and invite to us the guest of honor. Thank you so much.
Good morning. I couldn't work out why everybody's looking up into the sky, but I guess you're looking to see whether you're appearing on the screen. You all look rather angelic looking up into the sky. It's good to see you. I was beginning to doubt whether you would turn up. It's been such a long time that I've been getting updates in my office from the team about this Congress, and we've been very excited to be part of the planning for this meeting. I broke the news to them just a few weeks ago that I had to go to London to check up on my father, who, if you can see me in the light, you'll see I'm quite elderly. You wouldn't be surprised at all to know that he is very elderly, and I had to go and see him. But I managed to get back into Kigali at 9 o'clock this morning so that I could be here with you, because I want to say that one of the things that we believe in the University of Rwanda is that universities exist to serve young people. Universities exist to serve young people so that they may go on and serve other people, that they may actually transform the world. And the basis of everything we do in our university is founded on love. So I hope while you're here as part of this community, my community of learners in this university, that you feel and experience a sense of love and a sense of service from the people who are here to look after you and take care of you. And that's all I need to say, because my place here is an honored place. because I have the honor of welcoming the guest of honor, a pediatrician, a working doctor, a minister of gender and family promotion, and somebody who is an ardent force behind young people becoming the very best they can be, not only as a pediatrician, but as a minister of health, developing health services, developing young people through nursing education, pharmacy education, dental education, and medical education. I know just how busy the Honourable Minister is, and ladies and gentlemen, we're really, really lucky to have her with us. Dr. Diane Gashumba, ladies and gentlemen, the Honourable Minister of Health in the Republic of Rwanda.
Good morning. I'm just the Minister of Health. I used to be the Minister of Gender and Family Promotion, so don't think I'm combining both roles. Thank you very much to the University of Rwanda for hosting this important event. And I want to wish all of you a very warm welcome to Rwanda. We are very proud and honored to have you here, gathered around the 65th International Pharmaceutical Student Federation World Congress. It's a proud to have you here, engaging around such important topics. Our world today is a very young one, a home to 1.8 billion young people between the age of 10 and 24 years, and the largest young generation in history. Youth represent a window of opportunity for effective prevention and health promotion. Youth constitute over 53% of the population within the capital of Kigali. And in Rwanda, the leadership of this country considers youth as a strength for this country, as a bright future of Rwanda. When it comes to you young pharmacists gathered here today, your role should be played in accelerating and sustaining efforts to universal health coverage and investment toward universal access to essential medicines and vaccines. You should also play an important role in fighting falsified drugs that are circulating our world, especially in Africa. Effective financing mechanisms must be put in place to allow efficient procurement and reimbursement systems to minimize out-of-pocket payment by patients and protect them from any catastrophic expenditure that can lead them to poverty. Supply chains have to be robust, both to ensure delivery of product to the patient and to prevent diversions or entry of falsified product, as I said previously. Every young person has a contribution to make, not just at a high level. Young people have the power to effect change in their own communities. As I conclude, it's my hope that this forum will continue to serve as a stimulus for policy dialogue to improve our sector performance towards achieving universal health coverage. I want to thank everyone who traveled from long distance to come and visit Rwanda, and I really hope that you will enjoy our country, the beauty of our country, the safety of our country, and I wish you a pleasant stay in Kigali. I wish also to thank all the people who worked to organize this conference, and I do hope that this event will be a success one, and I wish you very fruitful deliberations, but also take advantage of our stay here to relax a bit, because it's important also. Thank you very much for your kind attention.
Thank you very much, Honorable Minister. Like I told you before, at this moment, I'm not going to say anything on top of what they have just said. You've heard for yourselves. Let's have the photo session before we can proceed to the opening panel. So on the photo session, I'll invite the EXCO to join these people already here. The IPSF EXCO, you join, and we are using this this space for the photo, and our cameraman will be helping us in arranging us in order. So IPSF EXCO will join, and also RPSA President can also join. RPSA President-elect, yes? Yeah, so let's, yeah. Let's also welcome the Country Director of Chemonics, Ines Wuchi, to join this photo. I'm giving a chance to someone to join this photo. Who is ready? I'm giving a chance to another person. Stand up, stand up, stand up. Join. Make sure you are orderly. Just join. Join. This is our event, right? Let's join the photo. Wonderful. The password is to make sure you are seen in the camera. That's make sure you are seen in the camera. Wonderful. Thank you very much. We can take back our seats. Yeah, so as you can see, the minister is staying for the panel. Yeah, so we're still honored to have the minister with us, and she's going to be sharing more. So I'd like to introduce a few people that are going to join these wonderful panelists. The minister is already here. You've already known her. And also Jadot, the chairperson of the reception committee, is here. Allow me to welcome Dr. Victor Moyo. Dr. Victor Moyo is an oncologist, a hematologist with substantial experience in development of several therapeutic approaches. Currently working at Leaf Pharmaceuticals as the Chief Medical Officer and Head of Research and Development. Dr. Victor has experience in conducting chemical research in Central and Southern part of Africa and has published on a number of topics in that field. He is also a co-inventor of several patents involving the treatment of several cancers. Dr. Victor, you are welcome on this panel. I also want to introduce Dr. Tresha Kava, who is the current Kalua, Dr. Kalua, who is the current general manager at Amref Enterprises Limited. This is a subsidiary of Amref Health Africa, running a portfolio of social enterprises. Dr. Fraser has many years of experience in health sector in Africa, and she has held leadership positions in pharmaceutical industry, health insurance, and chemical services. She is a medical doctor with postgraduate training in public health, and she's also experienced in administration and organization development, currently undertaking research for her thesis for her PhD. So this is the panel, and it's going to be moderated by another wonderful pharmacist, a recent graduate, a young professional, Humura Fabrice. The floor is yours.
It's very important.
Good morning, ladies and gentlemen. Good morning. Thank you very much. My role is very simple. It is to ensure an impeccable conversation between the audience and, of course, the panelists. But before we dive into our discussion, I want to create a bit of context. Over 30,000 people, most especially in developing countries, are undergoing into poverty bracket due to the health cost. And of course, as you can understand, most of them, they sell their biggest possession, which is land, in pursuit of health cost. How can we ensure that health is not like playing lottery, where the rich wins and the poor, of course, loses? At this juncture, ladies and gentlemen, we're promised that it's only through universal health coverage that everyone can have access to health, irrespective of their financial pocket. Sit back and relax, knowing that in 1 hour and a half, we are going to dive into discussion that is going to talk about paving the way towards UHC, but of course, involving young professionals. If may I start with you, perhaps, Honorable Dr. Diane. Rwanda showed an impeccable results concerning healthcare, most especially universal health coverage. It's only 25 years from 1994 genocide against the Tutsi. We are having over 90% of its population covered by community-based health insurance. Could you share with us, most especially young professionals who are coming from different countries here in, what made this journey a success, and what can be a take-home message to young professionals who are here in the house? Thank you.
Thank you very much. Before maybe responding to the question, I would like to know who is visiting Rwanda for the first time from almost everyone. who knows about the history of Rwanda? Because when we speak about the genocide, we want to make sure that everyone has an idea of what happened in Rwanda. Who knows about this? Almost everyone. So that's good. That's a good thing. So I was born in this country. I studied in Rwanda. I grew up in Rwanda. So I can say without any confusion that I know about Rwanda, I know the history of Rwanda, and I can testify about the progress made in the health sector, because today we'll be talking about the health sector. Before the genocide, meaning before 1994, we didn't have any medical insurance. Only people with financial means, enough financial means, could access to medical care. You can understand how difficult it was to get to medical services, quality medical services. I used to hear my parents saying, we are going to Butare. Butare is the southern province where the University of Rwanda and the medicine faculty has started. So it was almost, in addition to one big hospital here in Kigali, the teaching hospital, the Kigali Teaching Hospital, those two were almost the only hospitals that could provide good quality of care, to specialize the quality of care. So then, no insurance, so vulnerable people couldn't pay for medical services. And I have never heard about equal right to medical services or even equal right to education, because the system, the leadership that was leading the country before the genocide was promoting divisionism, and based on ethnicity, based on geographic origin, the country was divided, basically. You couldn't even hear someone talking about women's rights, gender equality. That wasn't even existing. We all knew that women were good for domestic works. They couldn't even attempt to apply for science studies. So there was nothing, basically. So after the genocide, because we have lost a million of people, including medical doctors, including nurses, including pharmacists, and infrastructure were destroyed. You will maybe have the opportunity to visit the genocide memorial to better understand what happened in this country. So after 1994, we had to rebuild everything from the scratch. We had to rebuild infrastructure, train people from the scratch. You know how many years it takes to train a medical doctor, a pharmacist. You know how many years it would take to rebuild the confidence of people, to educate to women and tell them that they are capable. They have to go to school. They have to be ambitious. They can apply for medical studies and sciences. So we had to put in place policies, guidelines. Even our constitution had to change to provide for these important changes, so that everyone, because here everyone respects the constitution, we had to provide within our constitution that 30% of all decision-making positions have to go to women. It was a kind of incentive and also a message to everyone that women have to compete, women have to feel confident and understand that they have the same right as men. We had also to provide for equal right to education in the Constitution, equal right to health, so that we bridge the gap that was existing. So we all decided to rebuild the unit of this country, to work as a unique nation, and to go through a reconciliation process that wasn't easy. And today we have a medical insurance that is covering 91% of all Rwandans, and it is in the Constitution. So 91% of Rwandans can go to a health facility without fearing the burden of paying from out of pocket. We also built we also chosen to build a system that is people-centered. That's why we have what we call community health workers. And those are people who don't have any medical background, but they were trained on how to communicate with the community, how to promote hygiene and sanitation, how to prevent diseases, and how to speak to their neighbors to make sure that prevention is a culture, is incorporated in our culture, because we had to fight against infectious diseases at that period. We had to prevent HIV, malaria, tuberculosis. After genocide period wasn't easy. The hygiene was destroyed also. There was no rules, nothing. So our system is community-based, and we have one community health worker per 40 households. The community health worker is trained on how to prevent diseases, how to communicate to the community, how to teach people to clean, to wash their hands, how to diagnose malaria. They can diagnose malaria using rapid tests, and they can also treat moderate cases of malaria. They can do the growth monitoring. They can monitor malnutrition within the community, but they can also treat simple cases of diarrhea, and they can also provide family planning methods, pills and injectables. So you can understand many things are happening at the community level. To give you an idea, 83% of diseases are managed at the community level. So as you go up, you find health centers, district hospitals, provincial hospitals, and teaching hospitals. But what makes our system strong is this insurance, so that everyone is contributing for almost $4 per year, every person, $4. And the government is subsidizing and completely paying for vulnerable people that are constituting 16% of the total population of Rwanda. And whenever you go to a health facility, if you have your card, your insurance card, you just pay 10% of the total cost. So that is explaining the success we are celebrating today. But we've got also good partners, because we have managed with Global Fund support, with the UNICEF, with WHO, with the private sector here in Rwanda. We've managed to have private pharmacies to complement the system that is built from the central level, that is distributing drugs to every single health facility, and also to the community level, drugs and consumables. So with this strong insurance system, we have managed to allow everyone to go for medical care without fearing the burden of paying from out pocket. Maybe let me stop there to allow my colleagues also to speak.
Thank you very much for that insight, Honorable Minister. If I would come to you, Dr. Flagia, you have over 10 years of experience with several non-governmental organizations. MDGs, was launched 17 years ago, and we are only 11 years ago to the end of SDGs. Nevertheless, we are still having hurdles concerning health cost. What do you think are challenges that need to be handled, most especially talk to young people in the room? What do you think are gaps that they can fill to have this a success by 2030?
Thank you very much for the question, and also thank you for inviting me. And it's an honor to be part of this panel. You rightfully have said that it's many years after a lot of commitment, even beyond the MDGs and the SDGs. And yet it's sad that we still have people in this world that cannot access healthcare, that children are still dying out of preventable diseases, mothers dying during childbirth, and people still not accessing the care that they require for various health needs. And to top it up, when they do get the opportunity to do that, many of them would then suffer financial impoverishment. And so as we sit here as professionals, I think it's a challenge to each one of us to play a role in contributing to universal health coverage. And I think we've spoken here about how the youth can be engaged, but to speak from a general point of view, we all know that one of the major issues regarding achievement of the SDGs is a financial component, where we still require to be innovative about how we finance the Sustainable Development Goals. And so beyond just investing more or increasing financing is how do we become more efficient? How do we have the dollar or the shilling go further than where it is today? And that's a responsibility of practicing professionals. Every time we dispense drugs that are not required, that's wastage. And therefore, we keep the system inefficient and therefore very expensive. And so we cannot achieve our goals. So the challenge to you as young professionals, as you enter the system, make it better. Be innovative, be bold, change how things are done, and make the system more efficient. The tool of our time now is technology. And I bet everyone here is technology savvy on Twitter and Instagram and all the other technology platforms. I think as you get into your profession, look at how you can leverage the tools of your time to make the health system stronger and to engage meaningfully as a young professional. I think going back to what the first panel spoke about, issues around information asymmetry with the communities as well as young professionals, there is need for us to increase the information that is shared with the young people. I'm not young anymore. Well, I'm over 35 now. But when I entered the system, there's so much I didn't know after medical school. And it's a challenge to universities and professionals that are practicing to decrease that information asymmetry, because if you are better informed, then you're better equipped to contribute meaningfully. Capacity development, but also challenging you that you need to challenge yourself to engage. You don't need to wait for government or other people or the advisors, as we were earlier called, to give you this capacity. There's a lot of training platforms that are free, open source. There's a lot of opportunity to engage senior professionals in your field, to learn from them. Don't wait to be called to a training for free. I think you need to invest in your own profession to then become more successful and to engage meaningful and to feel that you're playing your role. Humira, I think I want to stop there. There's quite a lot of challenges that we can all talk about, but let's talk about solutions today. Thank you.
Thank you very much. An applause for that. Maybe Dr. Victor can also react on that question vis-a-vis private sector as part of UHC.
Thank you, and thank you for inviting me to this distinguished panel. It is an honor to be here with my panelists, the minister, and my fellow colleagues here. And it really is a great privilege to have this discussion. I've enjoyed and learned a lot from just listening to the earlier panelists and what they had to say about the challenges that are faced as we look at this important aspect of the Sustainable Development Goals. I believe access to universal health care is goal number 3.8, if I'm correct. But it is important, and this is an important aspect of how we move forward as a planet, really, to really all get the most out of what this planet can provide for us. A lot of, I echo a lot of what has already been said, that, you know, in order to, it's going to take a lot of people coming together to move things forward, to address the challenges that we face. We always talk about the challenges, but as my fellow panelists just said just now, we should be talking about more solutions, and all of us can be involved and should be involved in the solutions. For me, who's been coming to Rwanda for the last 3 years, because our company has a base here, even though we're based in the US, we have a presence here in Rwanda. I've witnessed firsthand what can be done if there is a willingness from a multitude of parties, from government, from private sector, NGOs, to work together and move forward. It's really remarkable. Again, I'll echo Honorable Minister, what has been achieved here, that there's universal coverage here at the tune of $4 per person. And a lot more of us should really learn from examples that work. So when it comes to the private sector, of course, I represent the pharmaceutical industry here from my perspective. So some of my comments will be focused on that. But the private sector in general has an important role to play in supporting the initiative of access to universal healthcare. I mean, if you really think about it, it's an important partnership that has to exist between private health sector and government, because at some point, even when the government subsidizes, let's say, universal health care, the revenue has to come from somewhere. Someone has got to pay for it. And so a robust private sector really contributes through, first of all, taxes, if there is a good way of collecting those taxes, towards the universal healthcare system. Then the employees whose jobs are created by the private sector can also contribute to that. It's not a one-way street, however, in that sense, because if you have universal coverage, it is much easier to keep your employees healthy. So it works both ways from the private sector standpoint. So it's not as if the taxation of the private sector for this purpose is a bad thing. It is a very good thing, because having been part of starting a small company, a pharmaceutical company, I can tell you healthcare, particularly in places like the United States, is not cheap if you have to pay for it. And I would love to have, in the US, the ability to have universal healthcare. So one thing you realize is that it's not just the money that allows one to have universal healthcare, because we would have it in the United States. And the truth is we don't, which is unfortunate, and we look to a day when that will be a possibility. So just from a revenue standpoint, it's important to have a very strong relationship between, say, private sectors and other key stakeholders. The other important areas where the private sector can play a role is, of course, essentially innovation. So it takes money to innovate, to come up with new ideas. A lot of ideas come from private sector. If I could tell my young self 20 years ago, when I was as energetic as many of you sitting here, maybe 30, depending on how you look at it. Thank you. I would say, you know, there should be more people going into entrepreneurship. Even as you begin and consider your careers, it shouldn't be a one-way street where you look to work in one sector. There should be a broader mindset of how people want to approach their careers and Going into entrepreneurship is a good way of tackling many of the problems we as a society face, both in this country, in this continent, and globally. So it's going to require a lot of heavy lifting. I'm hoping many of you can consider that. On the farm sector side, research and development is what we are about. We do a lot of research and development. You can't go anywhere, and I'll speak about this in my other talk later on. You really can't come up with new solutions without innovation, and that takes research and development. So equipping oneself with those skills is really an important aspect of what needs to happen. And the private sector, coming back to this, plays an important role in that. As I travel through many parts of the world, and I recently spent some time around Southern Africa and Rwanda here, I noticed that there are many people with good ideas. What's lacking, actually, is the funding to support the good ideas. I know many of you sitting here have a lot of really great ideas on how to tackle some of the problems. So I implore you, for one, to keep knocking at those doors. But now, increasingly, there's a greater attention to the idea that there should be more funding, even from the private sector standpoint, focused on supporting people who have solutions to their own problems. I think an important aspect of this, and private sector allows one to do this, is so that we will see increasingly, even at the, let's say, the African Union level or other levels, more support towards research and development, and so people to come up with new solutions. I can go on, but it suffices to say is a very important relationship and contribution that private sector contributes here, and I'll elaborate more when there's time.
Thank you very much for that. You can applause. Before, of course, coming to the audience and, of course, respecting the tight schedule of our guest of honor, I would love to ask Mr. Jadot, as a young profession, how do you see the participation of young healthcare providers, especially pharmacists, into achieving UHC by the year 2030? Are there rooms to improve? Are you okay with that? What's your perspective on that?
Yes, thank you, moderator. Of course, there are challenges, but we should focus on the solution. There are too many. One of them is this particular juncture. You see, we are here gathered, and we are with the Minister of Health. That gives a particular instance of how young people are being valued. Now, the opportunities are there because when, for instance, our school for recent graduates provides a unique experience for students from different backgrounds, economic backgrounds, to meet in the same room and discuss. That's an opportunity for young professionals to know what are the challenges even in the remote areas of our country. So engaging youth for that particular case is of great use because they can talk about things that can't be forgotten. And then secondly, we have youth that are engaged in some particular instances of countries as a privilege. And you get, for instance, we met in one gathering and the representative of youth was 52. So we have some countries where youth are being represented by their fathers. Second, that's a challenge, of course. But for the opportunities, we have opportunities, of course. For being engaged at the table, it doesn't take being given a grant by the ministry to come to a position or to do something. We have a lot of ways to engage, like activism, like creative expressions that can attract the relevant stakeholders to see your value and engage you. I was talking about the opportunities. So for the challenges, they are easily being solved because we have countries that are showing examples to others of the benefits of using young people. We have the dividends of youth in different countries being so meaningful, like close to 50% of populations being young people. So if you neglect that part of the population, you're heading to nowhere, because while involving them in what you are building, you are even assuring the sustainability in the future. Thank you.
So it's the time for audience. Thank you very much, the panelists. You focused on opportunities that are there and that shouldn't be taken for granted. I want to be sure and certain about our guest of honor time. Over 80% in the room are from internationals, and I'm quite sure they will love to ask you one or two questions. How many questions do you think you have time for? I don't want to intervene with your tight schedule.
5.
5 questions, thank you very much. MCs, can you help us for 5 questions? And respect gender as well. 5 questions. I already see here in front, we can take two people. The other 2 and the one in front. 2, 2, 1. Straight to the question and the person you're addressing your question to.
Okay, my name is Akile. I'm from South Africa. My question is directed to the minister. As we've seen, Rwanda has made a significant effort in developing its healthcare system at the national and community level, making it possible for most people in the country to access the healthcare system. In South Africa, I think it's still on white paper, though, what we call the national healthcare the national health insurance, which is shortly called NHI, which is a financing system with a pool of funds that will ensure that everyone in the country, every citizen, can access the healthcare regardless of their socio-economic status. So I needed to find out with Rwanda, what were the challenges that you guys encountered upon implementing such a system, which I can see is doing marvelous work. However, in South Africa, the challenge that we're having, for example, we're having, I'll just give a hypothetical number. Let's say the entire population of South Africa is 5 million. We're having now 5 million people that are known by the government in documentation. Then the government, upon budgeting for the healthcare system, they only budget for that 5 million. Then you'll find that we have people that are not recognized by the government of South Africa. However, they still reside in South Africa. They can be roughly 2 million. And now you find out the system is overcrowded now. We're having now 7 million people accessing the overcrowded healthcare facility. So I needed to find out with Rwanda, how did you guys manage to make the system work?
Thank you very much. Your colleague had a question.
Okay, my name is Samgelo Dlamini, but a huge chunk of the question that I wanted to ask has been addressed by my colleague. I'm also from South Africa. The main thing that I actually want to know is how do you ensure that the policies and decisions that have actually been taken by the government of Rwanda or by the Ministry of Health are actually enforced or are actually implemented in the ground level, especially with the community-based healthcare, including the community workers who you stated that they do not have a medical background per se, but they are just given the information on different conditions or on basic healthcare. How do you then ensure that those decisions and those developments by the government are actually implemented from the ground level? Thank you.
Thank you very much. Let's take other 2 questions in this part. Yes.
Hello, I'm Rowan Dornagon from the Philippines. So we've been talking about innovative solutions in addressing or making achieving universal healthcare. My question is that how does the government, these institutions in Rwanda, support these innovative startups or these projects? We have examples here actually like Zipline, and I know a group of people trying to start like projects here to make to give accessible healthcare to medications. How does the government support these startups, and what are the hindrances also on your part? Thank you.
Thank you.
Hello, I'm Rian from Austria. My question is more general in general. You mentioned that you have a stable monetary system, and I'm just curious how it works. How much or how large of a percentage do you use from the overall fund for your public health system? And also, do you only do public health, or do you try to implement other parts like sanitary systems within that budget as well? Thank you.
One last at the back. Yes, of course.
Good morning. I'm Eric, a registered pharmacist in Rwanda, and my question is addressed to Honorable Minister of Health of Rwanda, and it's like this. I would like to know the challenges that Rwanda is facing in implementing universal healthcare coverage, as it is started through Mutuelle de Santé that is affordable for many Rwandans. And after knowing these challenges, we may or we must seek the intervention so that we can go so far in implementing universal health coverage strategies. Thank you.
Thank you very much. I see all questions were addressed to you, Honorable Minister. To make sure that I don't come back after the Minister, each panelist will give a 1 minute parting shot as we end our panel. Thank you.
Thank you to the participant for the very relevant questions. Yeah, the first one is how did we manage to make sure the system is working? Yeah, the first thing we did is awareness. And I think it goes with some of the other questions. Awareness of the community, but also involvement, making sure that they own the system, they provide ideas. We don't bring decisions from upper level to down. Our system, as I said, is people-centered, and the community has a say to every initiative you want to introduce for them. They have to understand it's for their good. Otherwise, you fail. And also, another strength or good positive things we have in our community, we all speak the same language. So the communication is smooth. You speak from the northern province, everyone will understand what you are saying. We have only one language in Rwanda. And also the bond between the community and the leaders, because most of the leaders, almost all the leaders at the community level are elected by the community. So they are neighbors, they choose their own leaders, and whenever they speak, they listen to them. But the engagement of the community, the fact that when we started this Mutuelle de Santé in 1999, we gathered ideas from the community. We explained to them that it's for their good. It's not something you impose. So I think that is the secret, but also the commitment of the leadership of this country. The fact that even our president is meeting the community on a regular basis, speak to them, listen to them, hear their question. This freedom of expression, people can ask any question to the president. We are accountable to our community, to the community we are serving. And we have in the country what we call performance contract. We sign performance contract with the community, with our leaders. Every leader from each level have to sign a performance contract with key indicators that are leading us to implementing our policies, making sure that the guidelines we put in place in the policies are not just on papers, are meant to be implemented. So we set up target for each condition. For example, I have within the ministry, with the team I'm leading, I have some target linked to reducing maternal mortality or neonatal mortality, or increasing the uptake of antenatal care services. So I have to achieve, the government has to give me whatever I need within the means we have, because we have to also acknowledge that Rwanda has limited resources, but health is allocated 16% of the total budget. To respond to your question, we have overachieved the Abuja Declaration. So health is considered as a top priority of this country, with all the cross-cutting issues that are not directly linked to health, but we receive 16% of the budget. It's never enough, but at least you got the maximum, the minimum of what you're requiring, and you sign a performance contract and you work toward the target. You know your baseline, and you know where you want to go, and you have the support from other social clusters, ministries, because, for example, I cannot work without the support of the Ministry of Local Government. I cannot work in isolation without involving the Ministry of Gender and Family Promotion, the Ministry of Youth. So we form what we call social cluster ministries, and we set priorities, and we monitor ourselves, and we're being monitored twice a year. We have a session like this with all the leaders, with the President of the Republic, with all private sector people, and it's an accountability day. So that's the way it is working, and how we manage to get our policies, including the insurance policy, implemented. But we have challenges. We have challenges because we don't have 100% coverage. So these 19% of people that are not covered still need to be sensitized, because they have to go to health facility. We need to treat them. We need to spend on them. So it's a continuous work, continuous awareness from the community level to make sure that one time we will have a coverage of 100%. Another challenge we have encountered is the arising of non-communicable diseases. And you know the treatment is expensive. So our mutuelle de santé has to follow, has to be adjusted. That's why recently the government has adopted a law revising the existing law on mutuelle de santé, or on community-based health insurance. We are going to charge some fees to telecom companies, to tobacco companies, to companies manufacturing alcohol, to revamp our mutuelle de santé, to make sure that we can add on the list of medicines or even medical acts that are covered under mutuelle, to make sure that we can expand this list and not having our mutuelle collapsing. So it's a continuous exercise, adjusting the need to the demand. Another challenge was that as we mobilized our people, they consult more. When I look at statistics 15 years ago, the number of consultations now is like 10 times 10 what it was in the past. So you understand, we need to keep restudying our system, readjusting, government subsidizing more and more, but also the premium from the community getting increased to meet the demand. But also this goes with the politics of reduction of poverty, because we want our people to upgrade and to financially be capable to follow this trend. About innovation, Rwanda is a country that is promoting innovation. We chose an example, that is Zipline. Rwanda was the first country to initiate the blood delivery using drones, and this has reduced the waiting time for a patient that is in a hospital in need of transfusion. The patient used to wait 3 to 4 hours to get the blood at the health facility level, because we have blood banks in each province that used to distribute the blood product and medicine using vehicles, but today we are using drones, and the time was reduced, was shortened from 3 to 4 hours up to 15 to 25 minutes. So you understand, this innovation is really saving lives, and soon we are initiating a study to measure the impact of drones in reducing maternal mortality, because we know that postpartum hemorrhage is the first cause of maternal mortality. And we hope that by using drones, it's not a luxury decision we took as a government. We know by intuition that it will have a positive impact, but we need evidence-based figures. We have a ministry in charge of IT and innovation. So the Minister of Innovation and her team have the responsibility to innovate, to look for innovations that would advance our agenda, to work with other ministries to get out from routine and innovate. And they work closely with the Rwanda Development Board that is in charge of attracting investors. So whoever wants to invest in innovation is most welcome in Rwanda, and the government is providing incentives, including financial incentives to any investor that wants to promote innovation, use of ICT to advance the development of Rwanda. I think I responded to almost all the questions. Did I?
Yes, thank you very much.
Can I leave? Am I allowed to leave?
Yes, thank you very much. Thank you for gracing our event.
And Victor Moyo should talk about an innovative drug they discovered in the US and that they are intending to bring to African countries. It's a drug against ovarian cancer and breast cancer, and we are going to sell the drug from Rwanda, but African countries will. I hope it's not a secret. I saw a press release on this. African countries will be able to access to the drugs at a low cost. This is also a challenge we faced because, yeah. So he has to speak about this. Thank you very much.
Thank you so much. Thank you very much for following us through the entire conversation. I hand over to MCs. Thank you.
Another big round of applause, please, for this amazing panel. Thank you, Honorable Minister of Health, for being with us. We know how your time is really crucial for us being really with us, so we thank you. As we proceed with the program, I would like to remind everyone the different panels we'll be having and where they'll be located. As we leave here, we'll be going for lunch. This is the time to go, and please use the time well to social and interact with different people we have here. I also hope that you have decided on which panel you will be participating in. But just as a reminder, if you look at the program, the panel 1, engaging all stakeholders for robust healthcare systems, this will be in this very same hall, MH4, where we are right now. This will be happening here, the panel 1. As for the town hall, with the topic Research and Development, a cornerstone for all healthcare aspects. That will be happening in AD 12. As you exit from here where we are, you continue down the hall and you take your right. That's where you'll be finding the AD halls. So this one will be in AD 12. And the second panel, under the theme Developing Human Capital Index, a new approach to achieving SDGs through young professionals. This will be happening in AD 10. AD 10. So to repeat, just to be sure, first panel right here, MH4. Second one, town hall in AD 12. AD 12. And for the second one, panel 2 is in AD 10.